Hi, welcome to our presentation today. My name is Josephine Suleiman, CEO and founder of Olivelink Healthcare. Having worked in the banking industry for 18 years, I retired in the year 2006 and joined healthcare as an administrator of a level 4 hospital. My job was clearly cut out, and this was to revive a dying business. I worked there for 9 years. And within this period, we received many mothers seeking delivery services from this particular informal settlement in Nairobi. And we used to wonder why. For a period of 2 years, we took outreach services to this community to try and understand the reason why they were seeking those services. And this was a facility that was like 7 kilometers away from that informal settlement. For a period of 2 years, we took in outreach services. And as we were interacting with these women, they told us that they needed a place where they could be treated as human beings. They needed a place where they could be treated with dignity. This is a statement that kept on coming up every time we were interacting with them. And this is despite the fact that there were facilities within this community that were offering healthcare services. Olivelink Healthcare provides accessible maternity and medical services to informal settlements in informal communities in Kenya. 2.5 million people living in the informal settlements in Nairobi have limited or no access to quality healthcare. Poor infrastructure hinders accessibility. So you find patients rely on lay healthcare providers and chemists who lack adequate medical qualifications. High levels of poverty dictate healthcare seeking behaviors. With a monthly household income of $140, only 3% is allocated to health. Maternal and infant mortality rates is 1.5 times higher than the national average. Public health system, which is affordable to the communities, is poorly managed. And yet, 50% of healthcare services is delivered by private sector who lack capacity and training. Olivelink Healthcare provides primary healthcare needs for the communities living in the informal settlements. Our services are accessible because we are located within the community that we serve. They are convenient because we are open 24 hours. All our medical personnel are qualified, all our service providers are qualified medical personnel, so we are able to offer quality services. Our biggest value is in the affordability of quality healthcare services. We leverage the use of clinical officers and nurses rather than the doctors who would demand higher pay. We have 2 clinics currently and offer a range of services. Our services include outpatient care, antenatal and postnatal care, maternity services, child wellness clinic, family planning services, laboratory, and pharmacy. As you can see, we have other healthcare providers that target the same community. We are the preferred provider because we are able to deliver high quality services at low prices. This is based on a research that was carried out within the community in January 2018 and August 2019. Meet Juliana Mwende, commonly known as Mama Evelyn. Juliana Mwende had a safe delivery to her baby at Olivelink Healthcare. She has also received immunization for her baby, and this is all possible because we are located 15 minutes walk away from where she stays. For the 8 years that we have been in operation, we have served over 90,000 patients and impacted over 450,000 lives. Amongst these are many Juliana Mwendes and their families. And it's based on a family size of 5 that is common within the community that we serve. We have capacity to deliver more impact. In the next 3 years, we'll be targeting the eastern side of Nairobi with a total population of 900,000 people. Our business model is in two levels. 40% of our clients pay using cash, and 60% pay using the National Hospital Insurance Fund, which pays at which pays a reimbursement at preset rates. So National Hospital Insurance Fund is one of our key partners. This is a government program where people contribute on a monthly basis to enable them access services across the hospitals across the country. The Ministry of Health is also one of our key partners as they regulate the health industry in Kenya, and they also provide us with vaccines that we use at the clinic. The pharmaceutical companies are also a key partner because they provide us with pharmaceutical products that we use at the clinic. Community health volunteers who act as a link between our clinic and the community is one of our key partners. These partners were key in the growth of our first clinic that we have bootstrapped. But for our second clinic, we were fortunate to partner with 4 funders who supported us with setting up costs to a tune of $60,000. Looking at the unit economics, maternity offers us the highest margins. However, across all our services, we have positive margins. We have 4 strategic initiatives that we wish to take on. Our strategic initiative number 1 is the hospital management system. This will help us to run more efficient operations and help and keep better track of our inventory. Our strategic initiative number 2 is the pop-up clinic. Pop-up clinic is a way in which we can take services closer to the communities without incurring a huge setup cost. We will also be able to test the market and establish ourselves within the community so that we are able to set up, if we are to set up a larger clinic in the future, we have higher chances of early success. The pop-up clinic will also help us strengthen our cash flows. We plan to open three pop-up clinics in the next 3 years. Our strategic initiative number 3 is the go-to-market strategy. We have not marketed much in the past, but with the ambitious numbers that we have, we need a solid go-to-market plan that can attract large numbers. We'll be working with a group of design thinking specialists to put this together. This plan will help us in client attraction, acquisition, and retention, and customer experience across all our clinics. It will also include a community engagement component, which will help with building awareness about the Olivelink brand. We will also hire marketing consultants to help us with implementation. Our strategic initiative number 4 is the baby care box. This is a strategy we seek to employ for our community services, our maternity services, which is not only a big need within the community, but also a service that gives our business a significant margin. We plan to use the baby care box as an incentive to see that the mothers are attending the required prenatal and postnatal services and getting their babies fully immunized. The baby box has various vital items to give the child a good start in life for the first 6 months, while also providing critical information to the mother about her health post-delivery. When we look at the new clinic economics, which is the pop-up clinic, we will be cash positive in the year 2022. However, we'll be seeking funding of $10,300 to help us in setup and operations for the first year. And this will ensure that the pop-up clinic will break even in the second year. Looking at all the financials on the business as a whole, we anticipate that we should be cash positive in the year 2021. We have, however, highlighted the figures that we'll be seeking as funding. In 2019, the loss shown was due to the setup of a new clinic that was yet to generate income. And in the year 2020, our operations have been adversely affected by the pandemic. The major assumptions that we have made in order to achieve these ambitious numbers is that our second clinic gets accredited by a National Hospital Insurance Fund. However, to manage this risk, our go-to-market strategy will have an element that specifically targets cash-paying clients. We are seeking 126,000 US dollars in grant form. 4,000 will support the setup and training for the new hospital management system. 31,000 will support the setup and operation for the first year for the 3 pop-up clinics. 31,000 will cater for acquiring of the baby care box, the M&E component, and the engagement of community health volunteers. We will also be utilizing the MTIBA platform to support the women to save for these boxes to ensure long-term sustainability. The MTIBA platform is a mobile platform that enables the women to save little money on a daily basis and put this aside for health purposes. $30,000 will go to the market, will support us in our go-to-market strategy implementation, and an additional $30,000 as working capital. With this ask, we will impact 1,250,000 lives and ensure that many women like Juliana Mendez and their families have a place that they can access quality healthcare services from. This translates to approximately $10 per life impacted. Meet Team Olivelink. This is the management team, but it is supported by other medical staff and support staff. The total team currently stands at 26, but this will grow year on year as our numbers grow. Thank you for listening and welcome aboard to help us achieve our dream.